Good evening and welcome to the Health and Wellness Show. My name is Chabet Birir, and today we want to talk about a rare disease called spinal muscular atrophy. And spinal muscular atrophy is a rare neurological condition that affects how you breathe, how you eat, and generally how you carry out your daily life activities. And with me on set, I have Dr. Sam Guer, who is a neurologist by profession, and he'll help us understand the condition better. And most importantly, I have Dr. Ann Mercy, who is a mother to a 1.5-year-old living with muscular atrophy, spinal muscular atrophy. Karibuni sana on set.
Thank you.
And I just want us to dive in directly to the explanation of what this neurological condition is, Dr. Sam. What is SMA?
I think the starting point is to first define what's normal. Your motor system, the part of the nervous system that is responsible for making you act or do whatever you need to do, walking, sitting, talking, that really starts from a pathway from your brain, the forepart of your brain, and then it flows down to your spinal cord, and then to the nerves. It gives nerves called the anterior motor neurons that then give information to your muscles to do whatever needs to be done. So there is a particular protein called survival motor neuron, which is then responsible for making sure that this nervous system works well.
Okay.
This pathway works well, particularly at the flow from the spinal cord and from the anterior motor neuron giving to the muscles. It requires regeneration, it requires replenishment of systems that makes this work. So in children and individuals with spinal muscular atrophy, they lack this particular protein, the survival motor neuron. And that occurs on account of a genetic variation or anomaly. So that's what spinal muscular atrophy is about. And what that means for these individuals, therefore, that which looks easy for you, like speaking, crying, sitting, walking, breathing, is a bit difficult for them, depending on the severity.
How is it diagnosed? How do you, as a neurologist, identify that this child has SMA? Or does it also affect adults?
Well, the first point, of course, is you have to have a high index of suspicion from a clinical point of view. And usually the children who present to us will be quite floppy. They may have challenges breathing. If in the severest of forms, mothers will tell you that even when the child was in the womb, there was minimal movement that they experience. And when the child comes out, you can see there's a bit of a struggle. If the clinician is attuned to assessing such children, they already feel there is some floppiness. They are at risk of respiratory difficulties and infections. They may have challenges swallowing. You may sense that they have a very weak cry. And those are some of the things that can manifest early that then piques your interest in doing genetic tests. If you have a good high index of suspicion, then you can go directly for a genetic test, which then clarifies this diagnosis. But in the other bit is that it can happen in adults. So again, depends on the severity. So that in the mildest of forms, adults become aware of it in adulthood. And in the middle, there are children who the challenge they will have is getting to walk, but they can sit. And in other cases, they can walk, yes, but they have a bit of challenge with other motor activities.
Okay. Thank you, Dr. Ari. Dr. Ann is a pharmacist, but today she's here as a mother to a child who has SMA. Tell us, Dr. Ari, how was it, and at the onset of SMA, how was it diagnosed and how did it make you feel? How was the journey? You said your son was diagnosed at 4 months. How did you feel, and what was going on in your mind when your son was diagnosed with SMA?
So we first developed difficulty in breathing. So we were just at home and we realized he's breathing so deeply and he's struggling. So we went to the hospital. While there, they diagnosed pneumonia. We were started on antibiotics, but they decided to keep us overnight just to observe us. During the night, his oxygen level started going down. So they put him on oxygen. And by the next day, he had worsened enough to go to ICU. So while we were there, we actually thought it will take maybe a week or so. Once he's on the antibiotics, he will get better and will go home. But after a week, the infection had cleared. The X-ray showed the infection is clear. His blood markers also showed that the infection was over. But at this time, they had actually put him on a ventilator to support his breathing. So more tests were done, more examination was done, and that's when he underwent a genetic test, which now proved that he had spinal muscular atrophy. Yes.
I'm sorry about that. And what have you been told needs to be done? Is there a treatment option, and how much does it cost?
So our doctor took us through what SMA is, what it means for our son, and the outlook of things. So there are 3 treatments, I think, in the market. So the one that will be the best option for our son would be the gene therapy. So this gene therapy is very expensive. So we have the one that's already registered that costs 2.6 million USDs, which translates to almost 270 million shillings. And then there's another drug that is similar to this one, but it is very new, not quite registered. So now that one is costing 100,000 US dollars, which is approximately 13 million Kenyan shillings.
All right.
Yes.
Thank you. And I'm sorry about your son. I hope that you get the help that you need. Daktari, please tell us, what are the treatment options when you diagnose SMA? What steps do you take as a neurologist to ensure that the patient gets to live a better life?
Well, as we can tell from Dr. Anne Mercy and her experience, they're both definitive treatment aspects and supportive treatment aspects. This child still needs to continue breathing. And if there's a struggle or they have decompensated on account of a respiratory tract infection, then they may have to be on a ventilator. And that's actually the situation for her son. Being on a ventilator all through since when they get in for an initial infection.
That was in October 2024.
Yes.
Yes, so you can imagine now it's 1 year plus. That's been 7 months over on the ventilator. The other part is the child needs to feed, and the business of feeding requires that your muscles contract and relax and push the food downwards. And the various valves also keep the food down. That doesn't quite work well, again, on account of the problem with the motor system. And in that respect, one of the things that we then do is look for alternative routes for feeding. In this case, a gastrostomy tube, providing a window for feeding directly to the stomach. There is a regular occupational and physiotherapy, at least to help maintain the muscles and prevent development of contractures. Contractures really mean that the muscles stiffen at the point of joints, and also to just help improve the bulk. And because they are really struggling to even breathe and do things that are basic, their nutritional needs are quite high, and that has to be curated with the help of a nutritionist. They are at risk of frequent chest infections, because then, your lungs should be able to push mucus and stuff that gets in easily, and that doesn't work so well. So there could be consideration about preventive antibiotics, flu vaccines, chest therapy to get that working well. So all those bits are supportive, and you can see it's a 24-hour engagement looking after such a child. Then Mama spoken to definitive treatments. And so you have spinal muscular atrophy because you're missing that survival motor neuron. And the whole idea behind treatment is, one, to explore whether we can replace the genes that are missing, or two, is modify your body to be able to produce where there's a potential.
Okay.
And so the way we define spinal muscular atrophy severity is you have both a gene that can produce, the SMN as you need it, but there's another gene, SMN2, that produces that SMN, yes, but not quite the way it should be. So what these drugs do is sort of modify this SMN2 to be able to work as well as the SMN1 protein. And she's speaking to gene therapy, which really means that you put the desired gene on a virus and place it in the system. The virus infects the nerves and plonks the desired genes on your code so that the production is appropriate. And it's an urgent thing, because as you grow older, then you start forming antibodies to viruses. And you also continue decompensating as far as your nervous system is concerned, which means some of the value and the benefits of early treatment may be lost.
Okay.
Yeah.
I know it's a rare condition, but as a neurologist, how many patients with SMA have you seen so far? Maybe say in a year.
Well, I could say that we get about 6, at least in our practice, in a year. And that is because genetic diagnosis is out of reach, and many clinicians are not attuned to looking for this condition. I believe it's much more, considering what you know of the genetic prevalence of the carrier status for SMA. We currently have, I think, about 9 children on care. The tragedy is that a number of children die of respiratory complications before they're able to access the medication. So a number of our children have actually died. And the medications that Anmas is speaking to are actually not formally registered in our country. So we have to jump hoops to get the Pharmacy and Poisons Board to allow them to be accessed on compassionate access or early access programs. And that process can be prolonged because of its bureaucracy, and not counting the associated costs that you need to get this medication. So that's a challenge.
What are the signs and symptoms of SMA? As a parent at home, you have a child, say, with a newborn baby, and especially those parents who live in less privileged conditions in the communities, in the villages. I know we have many cases of parents, we say it's rare, yes, but it could be, there's a high prevalence, but because it is hard to diagnose it, like you said, we don't have the full capacity as a country to reach out to those communities. How should they look out for symptoms? What are some of the symptoms that those parents at home, in the villages, in the communities, should look out for?
So one of the things that may be apparent to you if you is that your child may choke during feeding quite a bit, just because the muscles are not strong enough to keep on pushing the food down or the milk down. 2, you'll see already that their cry is not strong enough. Getting a sound out and a good cry is a bit of a challenge. You'll see that they're breathing a bit faster than usual. There may be a struggle here. And at night, there's features that suggest obstruction when they are sleeping. So those are very crucial things. When you hold on to your child, you feel like they're not bearing weight, Even when they're still young, they're sort of collapsing on themselves. And if you hold on the axillars, the armpits, they literally just slip through your hands. And that speaks to floppiness.
Okay.
And so those are some of the initial things that you can pick. For people who have the milder forms of SMA, then you'll see that they are not progressing through the various motor developmental milestones that you would expect. So they are not sitting in good time. And if they get to sit, they take time before they can sit without support. And if it may be that they are unable to then progress to stand and walk without support. And so those are some of the initial things. And you'll see that that is happening in the context of a normal birth history, that they never had any challenge in pregnancy or birth, and yet the child is manifesting this way.
Okay.
Now, the thing about children with SMA and adults is they are cognitively intact. So they are aware of themselves. If they could speak, they will speak. If you speak to them, they understand. And so, and I guess that's the reason why this is quite difficult and challenging, that they know already what's happening to their body. So that's an aspect also that's a crucial discriminator with other neurological diseases that will affect cognitive function.
Okay. Yeah. Thank you for that explanation. Now, let's talk to Anne. How is it on a daily basis with your child, from the time you wake up to the time you go to bed? How is your situation at the moment?
So my son is still in hospital. He's in ICU because he needs nursing care as well as ventilator to breathe. So my day basically starts at home because I also have another child. So we begin at home, I prepare her, we go drop her at school, then I go to work. I get to work for, say, until around 2 p.m. And then I go and spend now the rest of the day with my baby. So it's while there we just play. We play games, we sing, we watch Cocomelon, we read books. Basically, we interact. As the doctor said, cognitively he's okay. So you're able to interact. You're able to interact and play and bond. Yes. So that now from there, then I get to go home, and spend time with the rest of the family. Okay. And that's how my day basically looks like.
And what are the doctors saying the situation is with your son?
So I would say at the moment he's ventilator dependent. So that would mean that he would need to be on a machine, or he needs to be on a machine throughout. And with that, then we require a nurse, because other procedures like suctioning, removing the secretions in his lungs, dressing his tracheostomy. He has a tracheostomy for breathing, dressing his PEG tube. Now that is more sophisticated to be done by a nurse, so he requires around the nursing care. Then we also, he must, have physiotherapy and occupational therapy throughout, just because he's stationary. So you have to keep moving his joints, his arms, his legs, just, to keep them supple and possibly, develop some tone, which now he has lost from the disease.
Okay.
Yeah.
Dr. Ri, how is it on a daily basis taking care of a child with SMA? What does it take as a doctor?
Well, I think is to just go back to what Mama said. Parents are the first doctors for their children.
Yes.
And they know when child is not doing well, when they have a fever or is unhappy. So it's honestly a full-time job. And Mercy's child will probably require a home ventilator. And I guess it's figuring out how that can happen. And you have a home ventilator, then you have to think about regular electricity supply and the various supply issues and items that are needed to make that work well for you. From a doctor's point of view, we very much acknowledge and appreciate how much work it is then for the parent. As far as we know, it's quite an emotional drain, not barring the expectations in looking after the child and the costs associated with it. We're speaking of a multidisciplinary support system, and all these things costs. And even so, our practice environment has not optimally provided for some of those needs, you know. So things that you don't even have to think about, like a cough assist machine to help the child figure out how to cough. Those are bits that you'll wish that the children have access to, the parents have access to, like suction machines and the support system and the associated respite care in giving a break to the parents because, you know, you're there every other day and it's quite something. And we may not necessarily have such provisions in our health system. We rely a lot on relations for such support, but you will wish that there's that put in the health system. So I'll say the biggest deal has been that. And the cost of medication. So we've spoken mostly about the gene therapies and cracking and getting through the system to get the approvals is hard. But there are also the gene modifiers, one of which is oral and another one is administered through the spinal cord. We've really had good support from the pharmaceutical companies in respect to enabling us access some of the gene modifiers on compassionate access, and we have to appreciate that.
Okay. And is it genetic, or is there another way you can acquire without it being genetic?
Absolutely genetic.
Absolutely genetic.
Yeah, and when we say genes, so you've got about 20,000 genes that define who you are, and they define every facet of your physiology, of how you function. And we are speaking about a gene here that is responsible for producing the survival motor neuron, or a protein, which then essentially exists in most cells, but is most important in your nervous system.
Okay.
Now, the way things work with the SMA is it's autosomal recessive, which means you can have one of your so your genes
Family
exist.
member.
Yeah, the genes the genes you have are in pairs. So one side of the pair may be normal, but the other side may be the variant. And so you need two people who are carriers to get the condition. And so there's a 1 in 4 chance, if you're both carriers, that you could pass it on to the child. Now, as far as the general population is concerned, 1 in every 10,000 individuals is a carrier, which means in our country, where we have 50 million people, we are speaking of, what does the math work out? We're about 5,000 carriers.
5,000 carriers.
Yeah.
Wow. And for you, Anne, do you have a family member who happens to have SMA, or is it the case of just carriers and then it happened to fall on your child?
No, on both sides, myself and my husband, we have not experienced a child with SMA or any neurodevelopment disorders or challenges. So this was a first.
Okay.
Yeah.
And how emotionally? I know it can be draining. Is there a way you're seeking support mentally, counseling? Or are you in a support group? I know it's a rare disease, but do you have a group of people who have experienced the same with their children?
So, of course, it's not the easiest of things to imagine for yourself in terms of, how to deal with the cases, because, of course, they come with their own challenges, which you hadn't thought of. So it takes the emotional toll on you, just thinking, did I do something wrong? Should I have done something else? Is there something I could have done better, maybe, that could have prevented this from happening? So these are questions you might not be able to ask someone. So they really bug you at night when you're sleeping and you're wondering, what's up, what's next for your son. So I must say there are mothers, like we have a small group of mothers who have children with SMA, whether living or dead. So at least they help us, we help each other to accept the emotions we go through. So if today you're having a bad day, then they say it's okay, take that day. Just, take it off, just accept whatever it is you're feeling, it's valid. So they validate what you're feeling. We also help each other in terms of where to get some of these supplies that are needed by the baby, if it's the suction tubes, if it's the peg tubes, where you can get them at a good price, just so you can save on cost.
Okay.
Yeah, and then of course, when you compare, growth and all that, you get encouraged by a baby who is now, improving. Yeah, so I think that's how we are surviving day by day.
Yeah, thank you so much for shining a light on that condition, and I do really hope that you get the help that you need with your son. Thank you, Dr. as well, for explaining to us the condition. And we'll just take a short break. And when we come back, we'll talk about the stigma. It's a rare condition, but I'm sure that at some point you have experienced stigma with your friends or with your, community, in your community. So we'll talk about the stigma and how to handle it. We'll also talk about what the government can do to ensure that we get this treatment accessible to people living with SMA, in as much as it is a rare condition. Don't go away. Welcome back. Before we went for a break, we were talking about spinal muscular atrophy, that is SMA. My name is Chabet Birir, and this is the Health and Wellness Show. On this episode, we have Dr. Anne Mercy, who is a mother to a son going through SMA. We also have Dr. Sam Guer, who is a neurologist, and he is helping us understand the condition better. Karibuni sana once again, and thank you for coming on the show. So we were talking about stigma. How has it been? Have you had moments where you feel, I'm not being treated well because of my son?
I think mostly it's the backhand comments, where people think it's maybe on your side. Something happened, with grandfathers, grandmothers. The way there's always a trail of maybe someone offended someone, and now you have to think of, all those things. So I think for me, that is what so far I've experienced. Other than that, I've really gotten good support from the community. I think just they are slowly understanding that SMA is really not something you do to get. It just falls on you. And I think they are supportive. The community, family, the church, they're really coming in to just offer that moral, that social support. Yeah.
All right. Thank you. And Dr. Stigma is prevalent mostly in communities, in rural places where you find people saying that's witchcraft. This child has been cursed. Maybe there's something they did to someone or somebody that they gave birth to that child. Have you had cases of patients coming and they're experiencing stigma? And what can we do as as a medic and also as a community, as individuals? How do we help these people overcome what they're going through?
You're right. SMA and many other rare disease conditions are associated with significant stigma. And it boils down from lack of awareness of what genetic diseases are, and the feeling that it mostly is coming from one parent, usually the mother. And so that's quite a big deal. And we've spoken to where it is so difficult for the caregiver that then they keep away their children from the public and essentially fail to give or follow up on the care aspects that are necessary. I guess that can be very distressing. And if you are on the lower rung of the socioeconomic status, that's even far more difficult for you. Most mothers I know with children with SMA and other rare diseases are single mothers. Just for the reason that the men then leave. It's difficult. We must say maybe the men are the weaker sex, I don't know. I see Anne Mercy and husband together, and I'm really happy about that. Usually, even if they're together, the predominant weight is usually on the mother again as a primary caregiver. And that can have a toll on you. and there are issues around the workspace. If you're working, you know, there's just so much that a fledgling enterprise can allow an employee to take days off to look after a child with difficulty, and that also weighs on the family and parents. So stigma is a big deal. Again, kudos to the collective of mothers who have SMA, to the rare disease group also that's working on a regular basis to really explore opportunities for bringing to the fore some of these conditions, and the awareness that it is nobody's problem or mistake. Okay. As we've talked about, most conditions are actually recessive, which means both parents are likely to have been carriers for the child to have gotten it. So, and anyway, the randomness of the variations in our genes are so that even you as a carrier, it's not your mistake.
It's not your mistake.
Yes.
So, and how has it been, especially at work? Have you had cases where your boss does not understand that you need to go see your child? And how are you handling it?
So for me, I think I'm blessed. And God has really been kind to me. My employer, KU Referral, they've been very supportive in terms of psychosocial support, flexible working hours, you know, fundraising for my baby, just offering all types of support. And their doors are always open. So I think they understand when I say I need some time off, and you know, they're very supportive with that. Yes.
Okay.
Yes.
What can you talk about, you know, what can you tell employers who have cases like yours? Sometimes you find employers who don't want to understand that this is a mother who has a child with a special condition that needs attention. What can you tell them?
Maybe what I would say is, and especially for such mothers, they're usually in a vulnerable situation. They need to work to get money because the conditions also require you to be financially able. In addition to that, they are also having their own stress. You know, emotionally, they are not very strong. They're also dealing with the condition and how to help their baby and how to live. So I think the employer should take understanding of that. They should feel a form of responsibility in terms of supporting rather than trying to offload them. Because I know at the end of the day, they'll try to look at the bottom line. How are the numbers? Are we getting value for the money we are giving? We are paying to this mother. But if they would also look at it in a human aspect, that this is an employee who really would want to give their all, but once in a while they'll need to have clinic days for them to take their child for physio, for occupational therapy, and if they request for more support, maybe the institution can also support them. Yes, and also create awareness amongst other employees, so the employees don't feel like that mother is receiving special treatment. Yes, just to create that environment that supports that mother in whatever way they can. Is it free time, you know, additional benefits, be it bringing maybe a daycare closer to the workplace, just, you know, to enable the mother to have time to work.
Okay.
Yeah.
You've heard it from Anne. As an employer, please ensure that you have that space for someone who has a parent, not just a mother, not just mothers, even fathers. We have fathers who have children who are not well. So it is only right that as an employer, you give that space, you allow for that parent to be able to take care of their sick child. Now let's talk about the treatment options. You say that your son currently is going through physiotherapy and a cocktail of treatments, like Dr. Guer has said. What needs to be done for her son, Daktari, to be completely okay?
Well, completely okay, that's another story altogether. Considering we are starting the first phase of our life with challenges, we're already on a ventilator. In the most ideal of situations, you like that the child receives gene therapy from 0 age. And in European countries, there's actually screening programs for a child who's been born for a condition like SMA, so that then that medication can be provided as soon as possible. In this case, I know we are able to access, on account of support from Roche, a gene modifier, but then it will really be useful that they are able to access the gene therapy, which then would enable the body to produce normal survival motor neuron protein that is required to have the motor nerves to function the way they should. Hopefully, that then will mean improvement in respect to, for instance, respiratory effort, that we hope a time will reach when the child is able to breathe without ventilator support. It will help with swallowing, and also just making progress in respect to motor milestones, acquiring the posture that will be desirable, holding the neck and sitting without support, and hopefully eventually getting to be able to walk. It's been shown, at least, and for those who have initiated therapy early, that such interventions can actually get us there. Not perfect, honestly, but will get us to a space where we lead an almost normal life. And that's the aspiration. I see that before we get there, there are a number of hoops to jump in respect to supportive treatment. That is getting us out of the hospital environment and still being able to support ventilation. When we are talking about the cost of the medication, it's not just going to be about the cost of the medication. It's going to be the cost of all these other things that are necessary to deliver the support this child requires. And they are just as expensive as the medication. So that, I guess, put together are all those bits that make up a wholesome support for their son.
For their son. And how much has it costed you so far? Your son has been in hospital since October 2024. How has it been in terms of costs? Are you under insurance? And even if you're under insurance, I know, like Daktari has said, there are other costs involved. So how has it been financially for you and your family?
I think that has been a whole new, new elephant on its own. So we've been in ICU. An ICU bed is not cheap. Where we currently are, a bed is 26,000. So anything else you get from that?
26,000 per night or per
night? Per
night.
Yes.
Wow. Okay.
Yes. So you will also have the additional medicines. Anything else that's additional medicine, occupational therapy, physiotherapy, any consumables you'll be using, they'll be added to that bill. So far we've already done 12 million and counting. Yeah, so it
can be draining financially.
Yes.
I'm sorry about that. And how much, you said you need 25 million for the gene therapy. How much have you how much do you have so far? And how much do you need? Because I believe we need to help you get the help that you need. So how much do you need so far?
Yeah, true. So we arrived, so the drug is 100,000, which is around 13 million. You add logistics of getting it into the country is around 500 to 700,000. So that's almost another million. We have the hospital bills. And as Dr. Guer has said, it doesn't stop there. You will need some of these machines, even as the baby recovers. You'll need to buy the suction machine, a home ventilator. You also need to engage nurses, you engage physiotherapists. So currently we are raising 25 million. This should cover hospital bill, getting the drug, and the associated tests and costs. But looking at other mothers with similar kids, they spend a lot per month, so to speak. So it's either the mother stops working and stays at home to take care of the baby. Then maybe they can engage a few nurses and of course the physiotherapist for support. Or or you go to work and now you engage nursing services throughout. So you'll find that plus consumables, most families require around 60 to around 200K per month just to basically support the child to stay at home. Yes.
Okay.
Yeah.
I hope that you get that help. I really do. Daktari, for many families who have children or people living with SMA, that cost of just going to hospital and getting admitted might be a dream that may never come true. So what do you think the government should do to ensure that treatment is available to every child who is diagnosed with SMA or every individual?
Well, Rare Disease Kenya has been part of a conversation around engaging government, previously NHIF and currently SHIF, in respect to providing some cover to therapies like SMA. And I know we've not made much progress, but there's been goodwill. And you see that's read alongside the tension we have in our health system, where even the most basic of medical needs are yet to be met. The whole idea is to define packages that can help support, one, the supportive care that children with SMA need, and two is to access the definitive therapies. The farmers have also been useful to that extent. So, for instance, for risdiplam, one of the gene modifiers, for our patients who have to pay for it, for every one vial that they buy, and one vial is about 1 million, they get 3 extra for free. So that makes it for the price of one vial. And then the other has been that for certain patients who are not able to, they actually provide the drugs for free to these patients. So, you know, those arrangements are easier made by government. And I can see an opportunity to engage with pharma and explore pathways for support. I think it's absolutely crucial to consider registration and easier pathways for such medications via the Pharmacy and Poisons Board. They are orphan drugs, which means you don't have every other patient who needs them. And so it's not profitable for a pharmaceutical company to bring them over.
In stock.
And stock it, yes. So you can see that they require different consideration. And there needs to be supportive policy to help ensure that the access is better. And I surely do hope, for instance, that when Anne Mercy and Son, they get the medicine over, then it's not subject to taxation, isn't it? You can imagine that's going to be another layer of expense. So all these other bits are things that I think the government can do, in addition to also supporting awareness on rare diseases in general, because all of them put together, they then are not rare diseases.
They are not rare, for sure. Like I said, we may say it's rare, but it's not actually rare, because we may have families who have children with those conditions, but they're not coming out. And I also believe that as medics, I feel more research and data collection should be done, especially in African countries, so that, you know, people can be more aware of these diseases. But thank you so much for, you know, that insight. Dr. You're also a pharmacist. What can you say about medication for SMA? What do you think needs to be done in the country?
So I think the first thing will be to advocate for more research for these medicines, because it takes time for one to be developed, since they're not as profitable, because it's one in a very few. The number of patients who will need it will be very few in an area. So the pharma companies might feel it's not very profitable to venture into such research. But I think for pharma, if they were able to do more research, we could get more and more drugs in the market to support and treat such conditions. Also, I think if farmers would work with governments so that they can subsidize the cost of these drugs. So having a gene therapy that's
25 million shillings.
It's out of reach for most people. Even for us, it's quite out of reach. So if the government would work with such pharma companies, and another thing will be advocacy, because most people will not have heard of spinal muscular atrophy, and especially the ones at deciding tables. So they may not allocate, and I think this is something the Ministry of Health can take up. The people deciding on how resources will be allocated might not consider rare diseases. Yet, when that one case happens, it is a financial hole for the family. So unless now the government steps in by providing the supportive treatments, as well as providing insurance that can cover part or whole amount of the available drugs. I think that would really go a long way to ensure most babies are, screened, they get their treatment early, and possibly have a long life with a good survival rate.
All right, thank you so much, Anne. We have about less than 2 minutes, so I'd like both of you to just give your last call, your last parting shot, starting with Daktari, and then Anne, you'll tell us how you can be helped, how contribution, maybe there's a pay bill number that you can, just tell our viewers at home so that they can be able to support if they can support. Dr. Gwer, your parting shot.
Well, considering this conversation is public facing, essentially is to let the masses appreciate that some of these conditions, in fact, all these conditions are not brought upon the parents, and the children do not bring them upon themselves. And we need to appreciate that they need all the support they can get. We need to lobby and get the government on our side in respect to promoting access to care and putting in policies that essentially enable better care and treatment for these children and individuals.
Thank you so much, Daktari, and thank you for making time to come on our show. Dr. Anne, how can we help you?
True. So I think for me, I am appealing to well-wishers, all Kenyans, to help us raise these funds. So the thing with this drug is that it must be administered before 2 years. We are already 1 and several months. So we are running out of time, so to speak, to be able to give this life-saving gene to my son. So for me, I'm appealing to well-wishers, to all Kenyans, to support us by contributing to us. We have a fundraising ongoing just to get him the gene therapy. We have a pay bill. The pay bill number is 806-1567, and your account is your name. As well as you can follow us socially, just to support us, to share with your friends, because I believe if we were to get, say, 25,000 people, each contributing 1,000, we'll have reached our target. We'll be able to get my son the gene therapy. That would mean him coming home, staying with us, and eventually meeting the milestones that he has not yet met, and hopefully to go to school, have a normal childhood.
All right. Thank you so much for speaking out about your son. And I believe by you speaking out, it is raising more awareness to people, families at home who also may be going through the same condition, but they don't know what to do. So if you notice those signs when your son, that Dr. Gwer has said, your child has those signs of spinal muscular atrophy, they cannot be able to cough as a normal child. When you lift your child, you feel that they are weak, and you those other signs that Daktari has talked about, please take your child to hospital, and let's also help and get his son to live a normal life. Until next time, that has been today's episode. That's where we end. And I really do hope that you get the help that you need, Daktari. And I hope to see you again next week. My name is Chabet Birir. Have yourself a lovely evening.